My name is Mohamad Hussein. This is the first project for psychology, grade 12. Sleep apnea. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. If you snore loudly and feel tired even after full night's sleep, you might have sleep apnea. Symptoms: loud snoring, episodes in which you stop breathing during sleep, which would be reported by another person. Gasping for air during sleep, awaking with a dry mouth, morning headache, difficulty staying speak, or insomnia, excessive day, difficulty paying attention while awake, irritability, central sleep apnea. The less common form of sleep apnea occurs when your brain fails to transmit signals to your breathing muscles. This means that you make no effort to breathe for a short period of time. You might away shortness of breath, you have difficult time getting to sleep or staying asleep. This occurs when the muscles in the back of your throat relax. These muscles supports the soft palate, which is the triangular piece of tissue hanging from the uvula, the tonsils of the throat, and the tongue. You might snort, choke, or gasp. This pattern can repeat itself 5 to 30 times or more each hour, all night, impairing your ability to reach the deep, restful phase of your sleep. Sleepwalking. Sleepwalking is when someone wake or carry out complex activities while not fully awake. It usually happens during a period of deep sleep. This peaks during in the early part of the night. So slow, so slow, sleepwalking tends to happen in the first few hours after your sleep. Sleepwalking can start at any age, but is more common in children. It's thought 1 in 5 children will sleepwalking at least in their life. Most children grow out of it by the time they reach the adulthood, but they in time uh, proceeds into adulthood. Why some people sleepwalk? Why some people sleepwalk? The exact cause of sleepwalking is unknown, but it seems to run in families. You're more likely to sleepwalk if if anyone in your family has this problem. Have sleepwalking behaviors. What happens when a person sleepwalks? In some episodes of sleepwalking, a person may just sit up in bed and look around, briefly appearing confused. Others may get out of bed and walk about, open cupboard, get dressed or eat, and they may appear agitated. In extreme cases, the person may make out of the home and carry out complex the activities such as driving a car. Most sleepwalking episodes last less than 10 minutes. but they can be longer. At the end of each episode, the person may wake up or return to bed and go to sleep. They will not normally have any memory of it in the morning, or may have patchy memory. If walking while sleeping, the person may feel confused and not remember what happens.
Hello, this is the first psychology project by Ali Saeed and Mohamad Hussein. Today I will be talking about um, today I will be talking about insomnia. Insomnia can occur independently or as a result of another problem. Conditions that can result in insomnia include psychological stress, chronic pain, heart failure, hyperthyroidism, heartburn, restless leg syndrome, menopause, certain medications and drugs such as caffeine, nicotine, and alcohol. Other risk factors include working night shifts and sleep apnea. Diagnosis is based on sleep habits and an examination to look for underlying causes. A sleep study may be done to look for underlying sleep disorders, and screening may be done with two questions, which are: do you experience difficulty sleeping, and do you have difficulty falling or staying asleep? Symptoms of insomnia: finding it difficult to fall asleep, lying awake for long periods of time at night, waking up several times during the night, waking up early in the morning and not being able to go back to sleep, finding it hard to nap during the day despite feeling tired. Feeling tired and irritable during the day and having difficulty concentrating. Occasional episodes of insomnia may come and go without causing any serious problems, but for some people it can last for months or even years at a time. Persistent insomnia can have a significant impact on your quality of life. It can limit what you're able to do during the day, affect your mood, and lead to relationship problems with family, friends, and colleagues. There are no official guidelines about how much sleep you should get each night because everyone is different. However, on average, a normal amount of sleep for an adult is considered to be around 7 to 9 hours a night. Children and babies may sleep for much longer than this, whereas older adults may sleep less. What's important is whether you feel you get enough sleep and whether your sleep is good. Your sleep quality is good. You're probably not getting enough good quality sleep if you constantly feel tired during the day, and it's affecting your everyday life negatively. What causes insomnia? It's not always clear what triggers insomnia, but it's often associated with stress and anxiety, a poor sleeping environment such as an uncomfortable bed, or a bedroom that's too light, noisy, hot, or cold. Lifestyle factors such as jet lag, shift work, or drinking alcohol or caffeine before going to bed. Mental health conditions such as depression and schizophrenia. Physical health conditions such as heart problems, other sleep disorders, and long-term pain. Certain medicines such as some antidepressants, epilepsy medicines, and steroid medication. Treatments for insomnia. In some cases, a special type of cognitive behavioral therapy, or CBT, designed for people with insomnia, CBT-1, may be recommended. This is a type of talking therapy that aims to help you avoid the thoughts and behaviors affecting your sleep. It's usually the first treatment recommended and can help to can help lead to long-term improvement of your sleep. Prescription sleeping tablets are usually only considered as a last resort and should be used for only a few days or weeks at a time. This is because they don't directly treat the cause of your insomnia, but only treat the symptoms, which are mainly lack of sleep, and these medications are associated with a number of side effects that range from slightly negative to sometimes life-threatening. They can also become less effective over time as your body gets used to them. Narcolepsy. Narcolepsy is a rare long-term brain condition that causes a person to suddenly fall asleep at inappropriate times. The brain is unable to regulate sleeping and waking patterns normally, which can result in excessive daytime sleepiness or feeling very drowsy throughout the day and finding it difficult to concentrate and stay awake. Sleep attacks or falling asleep suddenly and without warning. Cataplexy, which is temporary loss of muscle control, resulting in weakness and possible collapse, often in response to emotions such as laughter and anger. Sleep paralysis, a temporary inability to move or sleep when waking up or falling asleep. Excessive dreaming and waking in the night. Dreams often come as you fall asleep. Hypogenic hallucinations, or just before or during waking. Hypnompic hallucinations. Narcolepsy does not cause serious or long-term physical health problems, but it can have a significant impact on daily life and be difficult to cope with emotionally. What causes narcolepsy? Narcolepsy is often caused by a lack of the brain chemical hypocretin, also known as orexin, which regulates wakefulness. The lack of hypocretin is thought to be caused by the immune system mistakenly attacking the cells that produce it or the receptors that allow it to work. But this does not explain all cases of narcolepsy, and the exact cause of the problem is often unclear. Things that have been suggested as possible triggers of narcolepsy include hormonal changes which can occur during puberty or the menopause, major psychological stress, an infection such as the swine flu or the medicine used to vaccinate against it, pandemics. Who's affected? Narcolepsy is a fairly rare condition. It's difficult to know exactly how many people have narcolepsy because many cases are thought to go unreported. Men and women are thought to be affected equally by narcolepsy, although some studies have suggested the condition may be more common in men. The symptoms of narcolepsy often begin during adolescence, although it's usually diagnosed between the ages of 20 and 40. Diagnosing narcolepsy. If you suspect you may have narcolepsy, you should see a medical professional, as they may ask about your sleeping habits and any other symptoms you may have. They may also carry out tests to help rule out other conditions that could be causing your excessive daytime sleepiness, such as sleep apnea, restless legs in bed, and kicking during sleep, or an underactive thyroid gland, known as hypothyroidism. If necessary, you'll be referred to a specialist in sleep disorders who will analyze your sleep patterns. This will usually involve staying overnight in a specialist sleep center, so various aspects of your sleep can be monitored. Treating narcolepsy. There is currently no cure for narcolepsy, but making changes to improve your sleeping habits and taking medicine can help minimize the impact the condition has on your daily life. Taking frequent brief naps, evenly spaced throughout the day, is one of the best ways to manage excessive daytime drowsiness. This may be difficult when you're at school or work, but a doctor or medical specialist may be able to devise a sleep schedule that will help you get into a routine of taking naps. This sleep schedule can also be customized to fit your profession or area of work. Keeping to a strict bedtime routine can also help, so you should go to bed at the same time each night whenever possible. If your symptoms are particularly troublesome, you may be prescribed medicine that can reduce daytime sleepiness, prevent cataplexy attacks, and improve your sleep at night. These medicines are usually taken as daily tablets, capsules, or drinkable solutions. Thank you.